Anterior periapical x-rays. Focus on the front. Positioning for anterior periapicals can be tricky, so it's really important for us to focus on the right angle to capture the root and the crown at the same time. For adults, we recommend using the Jazz Solo sensor when taking anterior PAs. This is the larger of the two sensors and offers the image area of a size 2 sensor with the comfort of a size 1. The goal of an anterior PA is to see the entire root, crown, including the incisal edge, and have open interproximal spaces of the front teeth. Remember to be mindful of the angle that the cord comes out of the sensor to avoid having the patient bite down directly onto it. For both upper and lower PAs, we want the sensor positioned so that the cord comes out closest to the platform that the patient bites down on. For anterior PAs, we'll use the blue Easy Positioner. We always recommend using the Jazz holder when taking anterior PAs to keep your sensor in place and prevent any accidental movement that could cause a compromised image. If you are not going to use the Easy Positioners, we recommend using the sensor shield to protect the sensor and a cotton roll to protect the cord. If you're having trouble capturing the incisal edge of the tooth, the cotton roll can also help with this. One quick reminder, when you stand in front of the patient looking at them, your right side is their left side. Whenever we talk about left and right with x-rays, we're always talking about the patient's left or right, not the operator's. This can be especially confusing for front teeth for some reason. Dentists usually prefer that you take x-rays in the order of tooth numbers. So for those anterior PAs on the top, you'd start with the top right canine and end with the patient's top left canine. For the bottom PAs, you'd start with the patient's bottom left canine and end with the patient's bottom right. For the upper front teeth, you want to take 3 PAs to see all 6 front teeth completely. We'll take one that's focused on the interproximal or space in between 6 and 7, one focusing on the interproximal space of 8 and 9, and a third that focuses on the interproximal space of 10 and 11. Because the front teeth are at a curve in the mouth, you need to take more individualized x-rays here to see the entire tooth and have the interproximal spaces be open. Pro tip here, place the bite platform directly centered and touching the target teeth in the area you're trying to capture, and then have the patient bite down slowly. This keeps the sensor well centered on the teeth you're trying to capture instead of you holding it in the air and then having the patient try to bite down. When you're ready to move on to the lower anterior, simply flip the Easy Positioner down so that the sensor faces down. You'll need to also take 3 PAs of the lower teeth to capture everything that you need to see. Focus the first PA on the interproximal spaces between the patient's left canine, number 22, and left lateral, number 23. The next one will position it directly between the 2 central incisors, 24 and 25, and the third will go in between the patient's right lateral and right canine, 26 and 27. Finally, you want the sensor, tooth, and x-ray tube all lined up parallel to one another when taking these x-rays so that the x-ray beam can go straight through or perpendicular to the tooth. This will give you the best quality image without distorting the teeth.